Welcome back, warriors. Kwe Tansei Sego. Hi, my name is Pam Palmater, and welcome to my YouTube channel where we focus on educating the resistance and inspiring the next generation of warriors to help us save our peoples and the planet. Canada was already in the midst of a major human rights crisis before the Covid-19 pandemic hit. Trudeau, a self-professed feminist, has largely ignored the gendered impacts of Covid-19 on Indigenous women. Stay tuned to find out what this means for Indigenous women as the virus continues to spread. Canada is in a crisis of epic proportions. Both Canadian and Indigenous governments are currently responding to the coronavirus pandemic in an effort to prevent the spread of the virus and save lives. However, Canada was already in a nationwide crisis before the pandemic turned into a global health emergency. In June of 2019, the National Inquiry into Murdered and Missing Indigenous Women and Girls final report found Canada guilty of both historic and ongoing genocide against Indigenous women and girls. The inquiry found that Canada's colonial structures, which specifically targeted Indigenous women and girls, leads directly to their current rates of violence, death, and suicide. Canada's subsequent failure to take urgent steps to end the genocide now puts Indigenous women and girls at an even higher risk of infection and death during this pandemic. To date, federal and provincial governments have offered very few details about their pandemic measures aside from daily updates on COVID-19 numbers and their basic health advice. Canada's Minister of Indigenous Services, Mark Miller, had previously announced $305 million for Indigenous specific funding, including $215 million for First Nations, $45 million for Inuit, $30 million for Métis, and $15 million for all of the off-reserve Aboriginal organizations. No funding was announced to specifically address the gendered impacts of this pandemic on Indigenous women, nor was there any funding allocated to simultaneously address the ongoing genocide crisis. This omission is part of a long-standing series of omissions by Canada that continue to deny Indigenous women and girls their basic human rights to be protected from abuse, exploitation, violence, and death. Indigenous peoples are a targeted group in Canada, targeted for racism, abuse, oppression, and dispossession. We were not born vulnerable. We are strong, powerful nations, only made vulnerable from centuries of genocidal laws and policies that have created and maintained severe socio-economic conditions in our families, communities, and nations. The staggering rates of poverty are one of the primary root causes of our premature death rates of upwards of 15 years earlier than non-Indigenous Canadians. We suffer from diseases at 4 times the national average, 3.5 times higher rates of unintentional injuries, and infant mortality rates are still 3 times higher. Indigenous girls have the highest rates of mortality in Canada, more than 6 times the national average. Nationally, 47% of First Nations children live in poverty, and in provinces like Manitoba, that rate jumps to 76% and continues to increase. Within all of these statistics are the often overlooked facts that the poverty of children is directly related to the poverty of their mothers, many of whom are single parents. The statistics paint a bleak picture for Indigenous women and girls. They have higher rates of suicide attempts overall, and Indigenous women who have had their children taken into foster care have significantly higher suicide attempts and completions. Add to this the fact that despite only being 4% of the Canadian female population, Indigenous women represent at least 25% of the female murder victims. They are the #1 targets of human traffickers and serial killers, as well as other segments of society. Indigenous women and girls have been regularly targeted for sexualized violence by police officers and have suffered from physical and sexual abuse in state institutions like residential schools, Indian hospitals, mental health institutions, and prisons for literally decades. Indigenous women represent 42% of the federal prison population and are the fastest growing. Indigenous girls represent 60% of those in youth corrections, but in provinces like Manitoba, those numbers can be as high as 85%. In Saskatchewan, 98%. And we know that 91% of Indigenous women and girls have suffered physical or sexual abuse even before entering prisons and corrections. Every level of government and state agency in Canada has had a hand in creating and maintaining the worst socio-economic conditions for Indigenous peoples, especially Indigenous women and girls. And their continued failures to address ongoing genocide puts Indigenous women and girls at higher risk for infection and death, but a whole host of other issues like domestic violence. Indigenous women and girls in prisons and youth corrections are literally trapped in institutions well known for overcrowding, unsanitary conditions, and a critical lack of access to health care. Add to this the number of Indigenous girls overrepresented in the foster care system, living in group homes, traveling back and forth between youth corrections and foster homes, or living on the street. And we see a very clear recipe for disaster. Indigenous women are also overrepresented in the homelessness population, and COVID-19 has already hit the off-reserve homeless population and prisons. If we don't act now, we could see far higher rates of infection and death in Indigenous women and girls than even during previous pandemics. And that's because the impacts of genocide continue to multiply over time when it's not addressed. During the H1N1 pandemic, Indigenous peoples were only 4% of the population, but represented 28% of hospital admissions and 18% of deaths. And we know that Indigenous women are far more likely to be the caretakers of children, elderly parents, and extended family members. And for those in the workforce, they are more likely to be working in helping professions like healthcare, social work, and education, placing them in direct contact with people and increasing their risk of infection. Canada's pandemic response must include a gendered lens that not only develops emergency measures for Indigenous peoples, developed in partnership with Indigenous governments, but it must also include a plan to address the specific issues related to Indigenous women and girls, done in partnership with Indigenous women. Federal and provincial governments need to work urgently with Indigenous women leaders, experts, and grassroots organizations to develop a gendered plan, one that significantly targets funding across a wide array of social supports to address their specific vulnerabilities. A comprehensive plan for Indigenous women and girls would include many things, including some of the following: a targeted decarceration plan with corresponding post-release supports that includes healthcare, housing, and family supports for reunification with children. An infusion of emergency funding for child welfare agencies dealing with Indigenous children in care, and the added supports needed for these children and their families so that they can both stay healthy and connected and reunified. Funding and infrastructure to maintain and expand emergency domestic abuse and rape crisis shelters, as well as both temporary and long-term housing solutions on and off reserve, so that Indigenous women and children will not be trapped by the virus into staying in dangerous situations. We also need an expedited Indian registration process for all the women and children who are newly entitled to registration under Bill S3 so that they can access critical programs and services. Right now, registration seems to be at a standstill, putting all of these families at risk. We also need supports like safe childcare spots for Indigenous women who work on the front lines of the pandemic in work like social work, nurses, medical supports, retail, and janitorial. They need these family supports. And at the root cause of all of this oppression and dispossession has been Canada's long-stated Indian policy of removing us from our lands to extract our natural resources. And that's why one of the most important things that Canada needs to do is to have an immediate and urgent moratorium on all man camps located at or near Indigenous communities to reduce the rates of violence and the risks of mass infections from the gathering of these workers. There should be a nationwide moratorium on any project approvals on any Indigenous lands, especially during this pandemic when we don't have the same kind of access to the courts or funding or ability to get out and defend our territories. While this is by no means a comprehensive pandemic plan, it is critical for governments at all levels to turn their minds to the ways in which Indigenous women and girls require targeted supports. If the current federal budget represents the extent of their Indigenous pandemic measures, then we have serious cause for concern. In the current context of ongoing genocide against Indigenous women and girls, it is critically urgent to develop a gendered pandemic plan now. A full-blown needs analysis is needed to inform a strategic plan that is based on what Indigenous women and children actually need, not arbitrary funding amounts dictated by male-dominated political Aboriginal organizations. Canada is guilty of ongoing genocide. Indigenous women and girls already have an uphill battle when it comes to their own health, safety, and survival. Canada needs to step up and make a plan that fully addresses the gendered impacts of the pandemic in the context of Canada's ongoing genocide and take steps to remedy both. Thank you all for watching my channel. This video was based on an article I wrote for Canadian Dimension magazine, which I'll post in the description box below. If this is your first time here, please consider subscribing, commenting, and sharing these videos with your family, friends, colleagues, and social justice allies. If you want additional resources, you can check out my website at www.pampalmater.com. And don't forget to check out my weekly podcast, Warrior Life, hosted on all the usual podcast sites. And I also have a new podcast just for kids called Warrior Kids Podcast, where we celebrate everything Indigenous and talk about how to be social justice and earth justice warriors. I wish you all health, safety, and shelter for you, your families, and nations while we continue to advocate for our brothers and sisters all over Turtle Island. Till next time, stay alert, warriors.